Hi, I'm Richard Freeman, President and CEO of Robert Wood Johnson University Hospital, Hamilton.
And I'm Sandy Haas, the Bariatric Program Coordinator here at RWJ Hamilton.
We're here to welcome you to the Center for Weight Loss. You've taken an important first step in your weight loss journey. You're learning more. And since everyone is different, Sandy and our exceptional multidisciplinary team work with you to create a weight loss plan that's tailored specifically to your needs, goals, and lifestyle.
That's right, we're here for you every step of the way. Your goal for a healthy life is ours too. Here you can feel confident that your journey towards that healthy life is a safe one. RWJ Hamilton is nationally recognized, time and time again, for our commitment to patient safety and quality of care. Mr. Freeman and I would like to introduce you to another member of our Center for Weight Loss team, our medical director, Dr. Sadek, who is going to tell you more about surgical weight loss options.
If you'd like to schedule a consultation with Dr. Sadek, call 888-724-7123 or visit us online at rwjbh.org/weightloss. We look forward to connecting with you.
Well, thank you for joining us on our bariatric seminar discussion regarding bariatric surgery. Today we're going to be talking about weight loss surgery, the benefits of bariatric and weight loss surgery, how do we help patients, and what to expect from the journey. Our group consists of 5 surgeons, as you can see, and I am Dr. Sadek. I'm the director of the program and the senior surgeon in the program. During your journey in this process, you're going to be able to meet with us, our physician assistants, our nurses. We have bariatric coordinators and insurance coordinator to help you with the process. We have dietitians and other consultants to help make sure that you are safe and steady and ready for such a change and such a big operation. Like I said, my name is Dr. Sadek, and I'm the director of the program at the hospital here. I'm also director of the adolescent program, and I have a clinical position at Rutgers as an assistant professor of surgery, and also in the pharmacy school at Rutgers. I am fellowship trained and board certified twice, and also fellowship trained in trauma and critical care medicine, which adds, depth to our program because it means that we can take care of the sicker and more difficult cases from a surgical and from a medical standpoint. Dr. Donaire is the most senior surgeon. He's also board certified and fellowship trained, and he is been with us for about 5 years now, and he has also performed over 1,000 procedures successfully with a very low rate of complications. Next is Dr. Melman, who is also our hernia director, board certified and fellowship trained as well. She's also an expert in hernia management, and she's also very well known nationally in treating complex abdominal wall problems. Again, adds a lot of depth to our program that, different patients, sometimes patients will come in with large abdominal hernias that require also weight loss surgery, and we can correct both problems even within our program. Dr. Antoine is also board certified and fellowship trained, and one of our junior surgeons, and he's been with us again for quite some time, and has performed a lot of these procedures successfully. Dr. Kudav is our latest addition. Again, all our surgeons are fellowship trained and board certified, and perform these procedures laparoscopically with the highest ability. This is Lisa Siracusa, our PA, and Jacqueline Taglia, our nurse manager in the office. So, what we're talking about today, we're talking about obesity as a disease, why it happens, how do we fix it, and why it's a global problem that we are trying to correct and help patients live a healthy, happy life. As you can see, obesity causes so many problems. There's basically nothing that we can find from a medical standpoint that is not related to obesity. Recently, obesity has been linked to multiple cancers as well. As you can see, it is linked to breast cancer, uterus cancer, cervical cancer, colon, and prostate. So now we're taking this to a whole new level, because I guess, question is, are we also preventing some malignancies by treating obesity? So it's not just the fact that obesity can cause many, many medical problems and can lead to life-threatening problems. The question is, on the long run, is it also contributing to malignancies, which, as you know, are terminal in some cases. So by treating obesity, we are preventing a lot of these malignancies and helping patients regain their health back. Obesity is also related to something called non-alcoholic fatty liver. And that's called, fatty liver is a condition that most people live with, but they just don't know the seriousness of such a condition. This, if progresses, can lead to liver failure and necessity of a liver transplant, and that's a big problem. As a matter of fact, some studies say that fatty liver is going to be the #1 cause for shortage of liver transplants in the world because of the amount of liver failure that it's going to cause. One of the closest things to me is the research in fatty livers, and we have multiple studies now conducted in our program trying to connect between fatty liver and liver cancer, and it seems that there is some connection between having a fatty liver and developing liver cancer in the future. So what is obesity? We all know that obesity is excess, fat outside the human body, but in the human body, outside, or inside. And the question is, how do we define obesity? And we define obesity by something called a body mass index. Body mass index takes into account the height because it makes a difference, obviously. It is not the most accurate way, but it's the most common way we use, because also we have to put into account the chest circumference, the neck circumference, the waist, and in relation. But for teaching purposes and for most people out there, body mass index is really the measure we go by. So normal body mass index goes from 18 to 25. Anything above 26 is considered overweight. And then you start with obesity classes. So obesity class 1 is body mass index above 30. Class 2 is between 35 and 40. Extreme obesity class 3 is body mass index above 40. How do you know your body mass index? It's simple. All you have to do is even look up either on our website or on any of the hospital website or even on Google. You just plug in your height, your weight, and it'll give you your body mass index, and it'll tell you how overweight it is. It looks into how much weight does the certain height carry or a frame carries. And when that percentage increases and becomes 35 and above, it is significant and it's severe enough that it requires an intervention, and most of the time a surgical intervention is really the best answer for that. Just to tell you how obesity increased over the years, this is the map of the United States, and all the states and territories show at least a 20% obesity, and in some instances it goes up to 25% or sometimes 30%. So what that means, it tells you that the problem has increased over the last 10-15 years, and it's growing exponentially. 35% or more of adults have obesity, significant obesity that can lead to significant problems. 65% of the population is overweight. The alarming data is that also medical problems are starting to arise at a very, very early age. Now we see people in their 20s that are developing high blood pressure, diabetes, and sleep apnea. These are not benign diseases, especially if you develop them at an early age and you have about another 30 or 40 years to live with that. So just looking at the problem and looking at how it's increasing over the time shows that we're still are not treating it adequately. We're not treating as many people as we should be treating. And a lot of people should come out and actually seek help, either surgical or none. 70% of adults are overweight or obese. Like I said, 17% of children are obese. That's an alarming number. And if you talk to pediatricians, they'll tell you now that they see medical problems that they weren't used to in children. High blood pressure and diabetes is developing in teenagers now. which is, again, a very, very alarming situation. 6.3% of adults are extreme obese. They're above 40%. That's talking about nationally and internationally. And of course, it's a very costly disease. And the annual death is 112,000 patients a year or more die from obesity. Just think about this, because, you know, that's a large number, because it's a steady number. And even if you look at some things like pandemics or acute diseases, even though they have a very high rate of death, it happens at a short period of time and then it stops. But obesity is a persistent and a consistent problem that leads to this number of deaths annually from obesity or related conditions. So why does BMI matter so much? Well, BMI matters because it tells you how high the risk is to develop problems. So if you look at BMIs, and if you look at the graph, and you'll see the BMI, as it increases, the mortality rate, the death rate increases. And there are studies showing that patients with a body mass index of 40 and above have 10 years less to live than their counterpart of patients who are not morbid obese. And that's a large number, and that's a significant reduction in life expectancy. Of course, obesity, like we said, is a very costly disease. You can see that it increases everything from labs and outpatients and medications and visits to pharmacies and so on. Obesity also causes a lot of restriction on the social aspects of life. That's something that so many times is being ignored and not focused on as much. But simple things in life, walking around, even going from the car to the office and back, up and down the stairs, walking to the beach and coming back is a problem. Joint problems are very common in overweight patients. Every 10 pounds of weight gain leads to almost 40 psi increase on the knee joints. Over time, 100 pounds of weight gain can really do a big damage to the knee joints and the hip joints and the ankle joints. So a lot of times patients have all these aches and pains and back pains, and the reason is the weight. A lot of times the medical doctors don't even tell patients that the problem is weight. I mean, they tell them to lose weight, but they don't discuss in details why weight is a huge problem. Sleep apnea, for example. A lot of patients have sleep apnea that's undiagnosed. Well, sleep apnea is a serious condition because it can increase the risk of developing sudden cardiac death. It can increase the risk of developing heart disease at an early age. Recent studies show that obesity is the #2 cause for atrial fibrillation, for example, which is an arrhythmia that happens to the heart. And I tell patients all the time, there is a point where I can treat and cure medical problems, but sometimes medical problems become so chronic that there's no way to cure them. An example is diabetes. In the early phases of diabetes, when we operate on the patient loses significant weight, the diabetes can cure. But if we wait till the patient develops insulin-dependent diabetes, and as you may know, type 2 diabetes starts with medications and then moves to insulin, because at some point in time, the pancreatic cells have completely been used, that even the insulin secreted normally by the pancreas is not enough to control the sugar. So the patient will start to convert into insulin, or the medical doctor or the endocrinologist will say, well, you know, we can't control your diabetes anymore by medication. We have to convert you to insulin. And once we get to that, that means that the pancreatic cells have been used so much that there's not enough pancreatic cells left. That condition may be hard to cure. Anything before that, I may be able to cure with an operation, meaning if the patient's on medication by mouth and still secreting enough insulin. That's just one example. Another example is heart failure. If patient having sleep apnea but not being corrected appropriately, and over time they develop right side of the heart failure, well, that's hard to correct. That may never correct. So we can cure things before they increase or get worse, and get the patient to a healthy lifestyle. That's why it's very important to be very prompt in treating this. There is another paper recently showing that even every day spent at a BMI of 40 and above, there's cardiac damage in the background that's happening that we don't see, patients don't feel, medical doctors can diagnose, but it's actually happening. And over time, it leads to a bigger problem. So just because the weight hasn't increased it doesn't mean that there's no damage going in the background from the weight itself. There's no wear and tear on the system from the weight itself. And again, it needs to be corrected in a timely manner. Who is a candidate for bariatric surgery? And that's a good question. So patients with a BMI of 35 and above with comorbidities, and comorbidities can be high blood pressure, diabetes, obstructive sleep apnea, fatty liver disease, depression, joint pains, back pains, etc., are candidates. Anybody with a body mass index of 40 and above is an automatic candidate, even if they don't have a medical problem, because the data shows that if the body mass index is 40 and above, the patient has a very high chance of developing one of these life-threatening medical problems. So we like to treat these patients earlier. Patient has to be healthy enough, of course, to undergo a major operation. We have to show that most patients have tried several weight loss measures and have not been able to lose weight. It's not about losing weight, it's about maintenance of weight. So a lot of times I get patients coming to the office that have been on one of these weight loss programs, whether it's Jenny Craig, whether it's Weight Watchers, whether it's any of these. And they tell me that I've lost 50 pounds, doctor, or 60 pounds, but I've never been able to keep them off. And it's about maintenance. So when we say surgery is successful, we're talking about initial weight loss and maintenance of weight loss. How many years does the data show that we can maintain this weight loss for? And most of these operations allow you to maintain your weight for about 5 years or more, because that's what we have from data. Past 5 years, the follow-ups are not as much and the studies are not as strong. But on average, a patient will maintain their weight for 5 to 10 years, and then they don't follow up anymore, so we don't have much data. But in general, it's the best way to lose weight and keep it off. Now, if you believe in what we call the metabolic set point, where the weight has been set so long because of the yo-yo dieting that no matter what happens, the patients will bounce back to their set goal, meaning somebody who's weighing 250 pounds, who have lost 50 and gained 40 and kept doing that for quite some time, the metabolic set point is set at 250 pounds. A patient is going to find it very, very difficult to lose that weight, even by diet and exercise and doing the things that used to help lose weight before. To reset the metabolic set point, we have to lose weight, a significant amount, but keep it off for a long period of time. And this period of time, nobody really knows, but average is 6-9 months or so. That way, we can reset the metabolic set point to a lower weight. This you can't achieve unless you have something like this operation, especially if you have 100 pounds or more to lose. Sometimes 50 pounds even become very difficult to lose just because of the frame and the height. So there's so much that goes into weight loss, and there's so much science that goes into weight loss and metabolism. And we have to approach this as a multi-organ system disease, not just a weight loss per se. We have to find out the patient's absence of drug, no psychological conditions, but depression is not considered one of them because depression is common. And of course, we have to understand the lifestyle changes, which we go through and help you and educate the patient to get to that. The first operation that we're going to talk about to treat obesity is called a laparoscopic sleeve gastrectomy. This is the most commonly done operation in the US, it's a restrictive operation. It means it just restricts the amount of food that you eat. Not just restriction, the amount of food a person eats is huge in weight loss. It's actually what everyone wants to feel like. They want to feel full quickly. They want to eat small meals. They want to eat healthy and not look for food or hunger or craves or things like that. And that's what this operation does. It's also a metabolic operation to a certain extent because there's a hormone that is secreted from the stomach, and it's called the hunger hormone. It's called ghrelin hormone. And by doing this operation, we cut the hunger hormone significantly. The patients are not hungry all the time. And at the same time, also the volume of the stomach is significantly reduced. The patients will not have the ability to increase the amount of food that they consume or eat out of boredom or eat out of just because it's there. It's a laparoscopic operation, means we don't make any big incisions, tiny small holes. It takes about 45 minutes of an operation and just a 23-hour stay in the hospital, which is huge. Patients are up and walking 2 hours after surgery. and they're drinking the same day, and they're going home like by the morning. So it's really, we have converted this operation here into a straightforward, well-tolerated operation. And the days of, patients laying in a hospital for days and laying in bed for days after surgery are long gone and long behind us. Patients can go back to work within a week to 10 days. Some patients go back longer. It depends on the work schedule, depends on the patient, depends what they do for a living, but on average, not more than a couple of weeks. The risk of complications from this operation in the program is less than 0.1%. So it's very safe. It's probably safer than most operations done worldwide for anything else. There is a 75% excess body weight over 5 years. So if you have 100 pounds to lose, you'll lose 75 pounds and you'll keep them off for 5 years or more. That's what the studies show. And that's a huge number. There's nothing else that can reach that. Next operation is the Roux-en-Y gastric bypass. This has been in the world for years, over 50 years now. We've been doing gastric bypasses, but it went through a series of changes that reached the level we have now. Laparoscopic surgery changed this operation significantly and made it a very good, safe, and actually relatively fast operation. It takes about 2 hours to do this operation, and the patient, again, will be up and walking in a couple of hours and then can go home in 23 hours. It's great for diabetes, so it's actually the instant cure for diabetes. This is the there was an article in New York Times a few years ago that quoted some of these medical papers, and it proves that this is the cure for diabetes. If somebody has bad diabetes, this operation can be the cure. Cure meaning patient can stop taking the medications right after the operation. Just because the way it's constructed and the way we bypass certain parts of the small intestine, we're able to metabolically cure diabetes that is a metabolic disease. Again, it's done laparoscopic without open like it used to be. The risk of complications in our program, again, is less than 0.1%. The long-term problems are not significant at all. If patient follows up the way they're supposed to and take their vitamins the way they're supposed to and follow up with us, then really there shouldn't be any issues in the future. And that's one of the things that worry patients sometimes. Gastric bypass used to have a bad reputation in the past. That was before laparoscopic surgery came, and laparoscopic surgery changed this operation, became a standard, and became a very safe operation. As a matter of fact, we perform a lot of it on a daily basis. And just to give you, a piece of information that this is the #1 operation in the world still, in Europe and other parts of the world. Gastric bypass is still considered the #1 operation for weight loss. The recovery time is the same, about a week to 2, just home, relaxing, nothing serious. If patients want to go back to work faster than that, they can very well do so. Lap bands is another operation that should be used for the right patient, shouldn't be used for everyone. The problem with lap bands and why sometimes patients read on the internet that they have bad reputations because they were used for everybody. They're only good for patients certain number of patients with low BMIs who are okay with also having an implanted medical device in them. It doesn't change their anatomy at all. It's technically can be removed and nothing will change in the GI system. But again, it's also an implanted medical device that's going to require follow-up monthly and adjustments. There's a small pouch that's created above the band, and that's what the stomach uses. That's what the body uses as the part of the stomach. But again, it has a long-term complication rate of 11%, where patients can develop acid reflux and require the need for this to be removed. It's a laparoscopic operation. The risk of complications is basically 0, and the patient can go home the same day. So for the right patient, it is the right operation. And that's why a consultation with an experienced physician who knows what operation is best can be very beneficial to the patient and can help make the right decision. The risk of bariatric surgery in general are, in general, this is the risk. But again, The risk of abdominal surgery in general is hernias or leaks or bleeding, dehydrations, but I can tell you that in my program, the risk of complications is less than 0.1%, and the most common problem that occurs is just dehydration. Sometimes patients are just unable to eat or drink quickly, unable to drink enough fluid in the first couple of days, and they can feel some nausea. But that's just the most common, and that's what we see the most. With the new system in place that we have, called the ERAS program, which is the Enhanced Recovery After Surgery program, all these complications have been cut to almost zero, and we're able to get patients out of the hospital without any problems. Resolving obesity can improve all health conditions. As you can see, something like obstructive sleep apnea can resolve in 76% of patients. Type 2 diabetes can improve by 70% of the time. High blood pressure, fatty liver, all that. So as you can see, that losing the weight, and losing the weight in a healthy way, metabolically or surgically, as we do, can lead to resolution of all these problems, which are life-threatening. And that's why we say that bariatric surgery helps patients increase their life expectancy. It's a life-changing operation. Talk a little bit about non-surgical weight loss procedures is the gastric balloons. These are good for patients who just need help losing weight, get back on track, get back on their system of diet and exercise. Gastric balloons are not indicated for patients who have had prior bariatric surgery. They cannot have this as a revision procedure. It has to be for somebody who's never had stomach surgery before. It can help patients lose about 20 to 50 pounds. But the average is about 15 to 20 pound loss at 5 years. It's placed endoscopically, so it's basically non-surgical, and it can be removed in 6 months under, again, endoscopy. It can cause some nausea and vomiting in the first 3 to 4 days, but then once that's done, patient tolerate and start. It basically fills the stomach, makes the patient feel like they're full most of the time, and that's why they eat less food. And really the risk of complications from something like this is almost, again, zero. It's just the nausea and the vomiting is the problem. Endoscopic sleeve gastroplasty is another new procedure that's out there. It's been there for about 4 or 5 years now. Again, I was one of the first surgeons to perform this, and I've performed more than anyone in the area. And I can tell you that it is a good procedure for the right patient again. It is done endoscopically, and it's trying to mimic what we do laparoscopic, meaning that when we do a gastric sleeve operation and remove portion of the stomach, in the endoscopic procedure, we actually suture that part and try to plicate it inside so it's not secreting the hormone anymore. The entire procedure is done endoscopically. It takes about an hour under general anesthesia, and it's a same-day procedure. Again, it's a good procedure for the right patient. And that's the most important thing, which we go back to the same thing I said before. It's very important to discuss all these procedures with the surgeon and try to figure out what is the best operation that can fit the patient's needs and achieve the results that we are looking for. Our program is the most decorated program in the state. We have excellent seals from the Metabolic and Bariatric Surgery, American Society of Metabolic and Bariatric Surgery, the Joint Commission for Disease-Specific Evaluations and Survey. These all designations are only present in our program. You will not find a better program with these certifications anywhere else. We also just want to touch base on what we call the ERAS, which is the Enhanced Recovery After Surgery Protocols. What we do is really how do we operate on a patient, get them out of the hospital in a timely manner and back to life in a very efficient and quick way with less complications, less problems, and less symptoms. And that starts from before the surgery and takes the patient all the way through the first week of surgery. By our program, how do we help patients lose weight before surgery? How do we pre-rehab the patient before surgery, what we do inside the OR, the medications we give, and post-operative part as well. How we converted this operation to almost a no-narcotic operation, meaning that patients are barely using any narcotics. And as we know from the narcotic epidemic out there, that it's better not to use narcotics if we don't have to. And most of our patients don't even fill their narcotic prescriptions after the operation. Like I said, they're up and running, walking around 2 hours after. And in a few days, I allow patients to go on a treadmill and start their journey early. The earlier the patient's on their feet, the better, the quicker the recovery, the less complications they have, the better success. That's why our program is one of the most successful programs probably in the country. So this is a quick seminar. It's a summary. It's not every piece of information that you are gonna want to know, but it's a quick introduction on our program, what's bariatric surgery, why we're so special, why we are better than other programs, and why we can get you through this process safely. My experience for the last 15 years and my laparoscopic skill has enabled me to teach all the surgeons how to perform these operations in a safely and efficient way. And I think our numbers speak for themselves. We need to, if this is something that you're looking for or even something that you want to discuss, you can schedule a consultation with one of our offices or virtually or in person, and we can discuss it in more details and try to figure out if this is something that you actually are a candidate for. Of course, the other stuff goes with it, where you verify your benefits, and then you start your journey, which will require about 3 to 6 months to complete. So the sooner you get, the decision, and as soon as you make the decision, the faster you're gonna heal and cure, the better your life is gonna be, and the quicker you're gonna get rid of these medical problems. And that's really what we're looking for. It's a lifelong commitment. There is enough support to help the patient get through this process and maintain their weight loss and a healthy lifestyle. But surgery is just the beginning. It's a tool that we give you, and what you do with it for the rest of your life is going to be your choice. We will be there to support, but ultimately it's going to be the patient's choice. And thank you all.
RWJBarnabas Health. Let's be healthy together.